The population thinks, oh, a fertility doctor, there's going to be a cost, it's expensive. A lot of insurances actually cover a lot of the treatments now, so that's something that we can reassure them.
Welcome to Wisdom Beyond the Womb. I'm Trisha Harris with Trisha Harris Photography, and today I'm sitting down with Dr. Nichols, and she's going to tell us about the journey of infertility and how she can aid you. Hi, Dr. Nichols. How are you today?
I'm good. How are you?
Good. Welcome. We're glad to have you.
Thank you.
I know this can be a very sensitive subject for many, but it's one we need to address so that people know there's answers. So tell me, what practice are you from? And what do you guys specialize in?
Yep. So I'm with IVFMD, and I'm a reproductive endocrinologist and infertility doctor, so a fertility doc. I've been doing this for a long time, about 15 years, and we are here to help women who are struggling to get pregnant. We also help women who have had recurrent miscarriages, and in general, the idea is just to have an idea telling women when they should come seek our help.
So when should they come see you?
In general, we say women who are less than 35, if they've been trying for a year and haven't been able to get pregnant. Women who are 35 or older and have been trying for 6 months, or women who are approaching 40 and haven't been able to conceive. Or women in general who have irregular periods, who have blocked tubes, if their partner has a male factor or a known sperm factor, or fibroids, then they can make an appointment with us.
And what does that process look like?
In general, the population thinks, oh, a fertility doctor, there's going to be a cost, it's expensive. And I think one of the things we can reassure people is most insurances cover all of the testing and us figuring out what that problem may be or what's going on, and that initial process of kind of the testing. A lot of insurances actually cover a lot of the treatments now, so that's something that we can reassure them. But in general, that first new visit is kind of figuring out and learning our patients and what's going on, how a woman's ovaries are functioning. Are her tubes open? Is her uterus normal? And how does his sperm look?
So most women may not even know this. They just know they've been trying for a year, nothing's happened. So do they sit down with you? Do they go through extensive testing first?
Yes, so they usually sit down with me or a doctor, and we talk about, in general, their history and what they've been going through, what they've done to this point. We then talk about what testing we want to do. So usually it'll entail an ultrasound to make sure everything looks normal. And then we do some basic blood tests and usually talk about making sure fallopian tubes are open. It's a very simple test where we push a dye through and make sure tubes are open, do an ultrasound test to make sure that the cavity of the uterus is normal. And then we talk about ordering a sperm test and kind of getting a basic idea to make sure that those functions are normal.
Sometimes this testing can be overwhelming, thinking they have to go to multiple locations and appointments. Do you offer in-house testing?
So in our office here in Viera, all of this testing is done in-house, which helps so they aren't driving to multiple locations, and it makes it really easy on them.
Now, IVFMD is throughout Florida.
Yep.
How does that benefit patients?
Yep. So IVFMD is throughout Florida. We have multiple locations, south and west. So actually, it's really helpful. I recently just had a patient who was traveling and at a baby shower and on the West Coast. And so she was going through some treatment and she needed an ultrasound and just popped into our Naples office. So right now, we do not have an IVF lab in the Viera area, but we are currently working on creating that. But the closest lab is in Jupiter, so it means for our IVF patients, for the day of their egg retrieval or their embryo transfer, they go down to Jupiter. But all of their blood work, ultrasound monitoring, which is the time-intensive process, it is all in Viera, and they just travel down to the lab for those two procedures. But hopefully in the not-so-distant future, that will be here as well.
Tell me some of the struggles that you find most patients are facing.
Yeah, I think in general, couples who are going through infertility, it's just an overwhelming process. A lot of the time they feel that they're in it alone. If they aren't talking about it with friends or family, then they definitely feel isolated and alone. Although if they start talking about it, they realize that they aren't alone and there are so many other people going through it. This week is National Infertility Awareness Week, and definitely the awareness and the realizing that 1 in 6 experience infertility is helpful. And so realizing that they're not in it alone.
A lot of people automatically assume if they're not getting pregnant, they have to jump to the big IVF process, but that's not always the case. We have less invasive procedures as well.
So I think just in general, figuring out what's going on and getting that diagnosis and that testing to figure out what we are working with and help a couple get that diagnosis. And then if it is a sperm factor, possibly helping them and seeing if there's something we can do with that. If it's an ovulation factor and a woman's not ovulating, what we can do in relation to that. So there are definitely, IVF is not always something you immediately have to jump to, although it does give the highest chance of success. There's things like inseminations and oral medications that can sometimes increase the chances of success.
I've seen a rise in my own clients conceiving through the infertility options. How have we seen an improvement in this area medically?
Yeah, so actually just this past week, data came out that 2.5% of all babies born in this past year were conceived with IVF, which is an unbelievable number. More couples are seeking fertility help and needing it for one reason or another. The technology of IVF is just improving. And part of it is it helps overcome tube factor, sperm factor so easily because what I explain to patients is when you are looking at conception in the body, we don't know what's always happening or what's not happening, to explain it a little better. So is the egg sperm fertilizing the egg? Is the embryo growing and dividing? Is the embryo implanting? We don't always know that or know what's not happening. In IVF, you get the eggs out and you see the eggs. You know a sperm is fertilizing an egg. You see that happening. You know the embryo is growing and dividing. And probably the biggest technology that has occurred and improved, especially as a female gets older, is that embryo is not always normal. And so the technology that has occurred and improved more recently is the genetic testing of the embryos. And so we have the capability of knowing that we are able to put a genetically tested normal embryo into the uterus, which has done two things. We're now able to put less embryos in and have a higher chance of success as we put one embryo in. So decreasing the risk of multiples and improving the chance of success.
That's amazing. After they've gone through a successful treatment of IVF with you, how long are they under your care before they referred out to an OB?
So usually we follow them until they're about 9 to 10 weeks pregnant, and then we call it a graduation and we graduate them to their OB.
Wonderful. We all have stories in our path that touch our lives, that just carry us through our career. Tell me one of your most memorable stories of helping a family.
Oh, that's hard, but there's so many. I have a patient, and actually she just reached out this week during National Infertility Awareness, but she is a patient that had significant polycystic ovarian syndrome and was not ovulating at all on her own and at all. And probably one of the highest anti-Müllerian hormone, which is a blood work that shows how many potential little eggs your ovaries have, that I have and had ever probably seen. And stimulated her, and probably one of the highest egg counts I'd ever seen on an egg retrieval, and took a few transfers because it was before genetic testing of embryos was done, and finally able to put an embryo back in, and she was able to conceive her son.
That's wonderful. Thank you so much for sharing your insight and knowledge with us today. How do people find you? Where can they get more information to schedule that first appointment?
So IVFMD.com. Our phone number and everything else is on there, but it's IVFMD and Viera.
Thank you so much, Dr. Nichols.
Thank
I enjoyed
you.
having you today.
Have a good day.